Dr. Nicholas Mercer with You Improve PT. I just released a video that takes you through a hip strength and mobility routine that you can do several times a day. Only takes 10 minutes, but it does require that you get on the ground. And I know a lot of people who are dealing with hip pain have trouble getting onto and off the ground, or even just being comfortable on the ground. So I wanted to show you how you can do this in a chair without having to get on the ground or lay on your back. Now, when you do lay on your back, some benefits to that, right? You can kind of isolate the muscles that we're looking to use a little better, because we're not having to hold our body up against gravity. But I would prioritize, I would think it's more important for you not to be experiencing pain while you're doing these exercises. And so if you do get pain when you're lying on your back, this is a great option for you. You can just do it in a chair. I would say make sure you're doing it in a chair that doesn't have wheels, something that's pretty sturdy. If you have something like this where there's no backrest, that will just encourage you to use your abdominals more to stabilize your body as you're getting the strength and mobility into the hips, okay? So let's get started. All you need is a belt, a regular belt. Doesn't stretch, nothing fancy to it. And I will put links to what I use in the description so that you can get them too. And then just a yoga block. You can also use a pillow. I like the yoga block because it's a little firmer, so when you press into it, it doesn't give nearly as much. All right, so let's get started. We are going to start out with, not this. We are going to start out with some pelvic tilting. We're going to do this a little differently than most people do it. We're going to actually go in 4 directions. So I'm going to show you from the side first. Okay, so I want you to have your hands right on your hips like this, because I want you to feel the abdominal muscles working. And what you're going to do is first pull on the belly button, and I want you to tilt your pelvis back. Okay, and here you should feel these deep abdominals working. And then you're going to go forward into anterior pelvic tilt. You should feel the back muscles working a little more, right? So you just do a few like that. So you're just kind of rolling your pelvis on the chair, right? Do a few like that. And then now I'm just going to show you from the front, because we're going to hike one hip up. And when you hike that hip up, you should feel the obliques, the muscles on the side here tightening, and then hike the other hip up, okay? So you're going to bring the left hip off the seat and then the right hip off the seat, okay? So this would be lateral pelvic tilting, okay? Now we're going to do a set of 5 where we do all 4, right? So first we're going to posterior pelvic tilt, so tilt the pelvis back, forward, return to neutral, left hip up, right hip up, okay? We'll do that a few more times. Left hip, right hip, back, forward, left hip, right hip. And then one important thing to remember when you're sitting is always try to keep the top of your spine, so the top of your head, reaching towards the ceiling. Just do one more. Posterior, interior, left lateral, right lateral. All right, we got that down. Good job. So now you're going to grab both the yoga block and the belt, okay? So the belt should be at about a loop so that your knees are about hip width apart. And then the yoga block is just going to shove right there, okay? All we're going to do, spine nice and tall, squeeze into the yoga block. You should feel your adductors turning on. Pull the belly button in. Hold 1, 2, 3, 4, 5. Push out into the belt. 1, 2, 3, 4, 5. And if your yoga block starts to slip, just hold on to it. And you're just going to alternate 5 times, right? So 5 seconds in, 5 seconds out. Keeping that belly button pulled in the whole time. Rep number 3, 4. You keep that belly button pulled in, keep the spine nice and long, top of the head to the ceiling. 5. Awesome. So now, all you're going to do, get rid of the yoga block. I'm going to show you this one from the side. We're going to do a modified hip bridge. So in your chair, you're going to rest your hands down. You're not gonna push out maximally into the belt, just enough so that it stays taut and it doesn't go loose like that. And all you're gonna do is a modified hip bridge. So you're gonna keep that out, you're gonna bridge the hips up. You feel the booty squeeze, hold 1, 2, 3, come back down, okay? 1, 2, 3, come back down, right? So most important thing here, your hips are moving up and you're feeling it in your butt. Your butt should be really squeezing nice and strong, okay? I think this is 5, 6. I'll show you a few from the front. 7, 8, 9. Again, keeping your belly button pulled in the whole time. And 10. Whew. And you should feel your booty kind of getting a little tired by the 10th one. Take that belt, throw it to the side. Now last, for the strengthening portion of this routine, we're going to do an isometric hip flexion activation strengthening exercise. So what you're going to do, you're going to push down into your knee with your hands, and you're going to push up into your hands with your knees. So you should feel your hip flexors working. Okay. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. This should not be painful. If you feel pain in your hips, if you feel pinching in your hips, you're going to want to decrease the angle of your hip flexion, right? To an angle that's not pinching, but you can still get nice activation through there, okay? But for now, I'm just going to show you from here, okay? So that was 1. This is 2. Just holding for 5 seconds. Keeping that belly button tight, keeping the top of the head towards the ceiling, trying to hit the hip from every angle. Yeah, I'm shaking a little bit. It means this is good. It means I need to do this a little more. All right, good. So that's it for kind of the activation strengthening portion of this hip routine. Now we're going to move on to kind of more stretching, mobility, flexibility exercises. Just 2 of them to get you started. First one's going to be for the muscles in the back of your hip, right? So all you're going to do is cross one leg over if you can. If this is too high, if you get pinching, let that other leg straighten. Right, so if this is too high, I'm not really great here. Lower the hip angle. And the goal is to pull this knee to the opposite shoulder, okay? It's not so much a figure 4 stretch where we're coming down like this. I want you to just focus on getting that knee over to the opposite shoulder. So here's what it looks like from the front. We're just gonna hold this for about a minute, okay? Nice deep breaths. And again, when you do these exercises back to back, it should only take about 10 minutes to complete. Almost half of that being stretching, right? Because we're gonna do both sides for this stretch, okay? So we'll call that about a minute. If you're like me, you don't like having a timer, timing a minute. If you're breathing slowly, we call that about 6 seconds. So you can just focus on doing 10 nice deep breaths. Right, keeping my spine nice and tall, belly button pulled in as I exhale, and I'm letting the hip go over like this. And you should feel this kind of through the side of the back of the hip that you're stretching. So try to bring it over to the opposite shoulder. Spine nice and long, deep breaths. And after about a minute or about 10 deep breaths, you'll relax and we'll move on to the last stretch, the last movement. So last, to get you ready for the day, get you a little more stability in the hips, some activation and some stretching. We're gonna do a hip flexor stretch from sitting. All you need to do here, this will be a lot easier in a chair without armrests, but you're gonna scoot to the edge, take the leg, you're gonna stretch and let it fall to the side, okay? So most of my weight is going through the hip that is sitting down. For me, just because my legs are kind of long, my knee is on the ground, but I'm not really putting weight through it, okay? And I'm just gonna squeeze the glute of the leg that's down to push the hip forward, pull the belly button in, spine nice and tall. And you should feel that stretch through here. If you don't, try to lengthen your spine a little more, squeeze the booty a little more, and you should feel that stretching to the front here. Again, about 10 breaths. That'll be about a minute, or time yourself for a minute. Okay. And then you switch to the other side. I'm going to show you this side going forward so you can see from that angle. So I'm just bringing this leg down. Again, I got kind of long legs, so my knee's going to touch the ground, and that's fine. Okay. And I'm going to squeeze my hip over here, drive that hip forward, spine nice and tall. I'm going to feel a stretch right to the front of my hip here. Okay. And again, just 10 nice deep breaths, or time yourself for a minute. Get that booty squeeze, tightness in the booty. You can spank yourself, see if it's still tight. All right, and then relax. Oh, you can kind of shake the legs off a little bit if they're a little sore. And that's your quick 10-minute routine. You can do a couple times a day, especially if you're dealing with hip impingement, arthritis, FAI, labral tears. That should help give your hips some stability for you to manage your pain throughout the day. Now, if you're looking for a more complete solution, I suggest you check out the You Improve PT app. It's completely free to download, and you can try the FAI and labral tear program absolutely free for the first week. And even people who just do the trial find that they get amazing results. People who do the full program, even more results. So we're getting some really good feedback from that. So check that out if you're interested, or just keep watching our free videos on YouTube to continue getting relief from hip pain from impingement, arthritis, FAI, labral tears. And make sure you comment down below with your story about how you got into pain and what you've done to try to get out of pain. We really want to hear from you, and really want to hear from our community. So thank you so much for watching, and we'll see you in the next video.